Thank you, Charles. And so I wanted to ask you a couple questions. I know that HIV criminalization is a huge issue, and for those who don't know, who live in D.C. does not have any HIV specific laws, but Virginia and Maryland do. And so, just wondering, what are some of the campaigns or anything that you can show or know that people have been working on specifically, and what they've done to maybe challenge some of these criminalization laws?
Well, certainly AIDS United has been very involved and engaged in this conversation, and I think that's a good starting point, certainly, looking at us. There are also a number of organizations, across the board. I think certainly the Federal AIDS Policy Partnership might be a starting point. The CDC, I mean, there are good folks there, great folks there doing amazing work, and I think there might also be a point of contact there. To just begin having a conversation. But I mean, there are also things you could do individually, like writing opinion op-ed pieces. Would other folks on the panel like to speak to this too? Was that okay?
Well, I actually speak to it. I'm not a panelist.
Oh, okay.
I do a lot of work around HIV criminalization, and that's why I'm trying to bring it out of them. But when we're talking about, there's actually the Center for HIV Law and Policy. One of your colleagues, Bill McCall, I don't know if Bill's here yet today, but he is a member of the Positive Justice Project, which is out of the Center for HIV Law and Policy, and we work in coalition to really confront some of these laws around HIV criminalization. Just to let you know, I mean, it's fascinating. I don't know if we even mentioned the fact that, we mentioned that there doesn't have to be any transmission, and a lot of times lawmakers use the excuse that they're protecting women when they make these laws. However, you should know that a lot of women have been impacted unjustly by these laws, because all it takes is, she didn't tell me. And it's he say, she say, or he say, or whatever. And that's all it takes. And the person who is positive usually always loses. So there's no way to prove that that person told them they don't have HIV, it wasn't transmitted to them. And so, I know a woman who was sent to prison, felony conviction, lost custody of her child, and when she got out, she had a sex offender. What do you call? What's the word? Right, a label. She was labeled as a sex offender when she got out, so of course she didn't have access to her child, and she's fighting to do that. And this is what happens. In most of these laws, everybody who gets, prosecuted comes out with a sex offender status. And it's not exactly what we think of as when we think of sex offenders. We don't think of people who had consensual sex. That's what happens when people transmit this virus. It's usually transmitted with someone who decided to have consensual sex. And so there are a lot of issues when we start thinking about criminalization. Really, we start thinking of what media has played in our mind, and that is the vision of somebody who's going out and infecting people on purpose and intentionally. So I just wanted to kind of get that into the conversation around when we talk about policies that breed stigma. So yes, sure, Daniel. I don't want to take over my own panel, right?
No. I think this is really good points, and I think it's really important to sort of weigh in on sort of the impact that HIV criminalization plays, because it is by and large probably would be the biggest producer of stigma-related and discrimination that would happen across this country. But because I'm sort of speaking from a policy perspective, it's important to note sort of how this all got started, and this is really because of the Ryan White Care Act. When the Ryan White Care Act was passed, as most of you who work here at the federal level might know, there are negotiations and compromises that you're making along the way. And as part of the passage of the Ryan White Care Act, the compromise was that states would be allowed to put in place statutes and policies that would diminish the potential of the transmission of HIV and AIDS. And it was sort of said very broadly, and because of that, those states then decided how they would enact their own particular statutes and laws. And I say that because as we talk about the Patient and Protection and Affordable Care Act and the Essential Health Benefits Package, that's why it's so important for the federal government to say, what are the guidelines for that Essential Health Benefits Package? Because if the federal government doesn't say if the federal government would have said, what are the guidelines to creating your statute, it probably would have been a different outcome than we're dealing with right now with 33 states who criminalize HIV.
Exactly. Okay, we're going to keep moving, and we have Dr. Nick DeLuca, who I work closely with. The Congressional Black Caucus is part of a partnership of 19 civil rights and social justice organizations focused on the Black and Latino community, and we're called Act Against AIDS Leadership Initiative, and he is our leader at the CDC. Let's take it away.
Hi, good morning, everyone. I'm going to ask everyone to stand up for a minute. You all have been sitting so long. Stand up. I want you to stretch up to the sky. I want you to put your arms out and shake them out. I want you to twist a little bit. And then if you can, take a seat. And I realize I'm the last speaker. I'm standing between you and lunch, and the longer I stand up here, I'm going to start looking like a turkey sandwich or something like that. So I'll try to engage you and keep your attention. It is a real pleasure for me to be here, and I want to thank Howard University. I want to thank the conference organizers, and I want to thank all of you for being here and taking the time today to spend time to talk about this very important issue. What my charge is, as Lisa said, I'm from the Centers for Disease Control and Prevention. I head up the unit that does all of the social marketing campaigns. So when Charles mentioned the power of social marketing campaigns, I promise I didn't pay him to say that. It was really great for him to hear that. I want to share with you some of our efforts. So what I would like to do is I want to talk about the overall Act Against AIDS program, and then specifically about a new campaign, a general awareness campaign that I have called Let's Stop HIV Together. So to begin with, just so to give you some context, CDC has a program called Act Against AIDS, and I call it a program because it's not just a campaign in of itself. It's comprised of several different sub-campaigns, so I call it the umbrella program, as well as different partnership activities, which Lisa mentioned and I'll talk more about in just a moment. This was launched in 2009 by CDC and Health and Human Services at the White House. And we're in our third year of implementation, and overall, for the 5 years of the program, we have about $45 million. That works out to about $9 million a year. So the overall goals of the program are to increase information-seeking behaviors and knowledge and awareness about HIV. It's important for us to keep HIV on the radar screen of the general population in America, in particular for populations most heavily impacted by HIV. So not only do we want to increase awareness, we want to influence behavior change, and we want to include HIV prevention and testing, and primarily for high-risk populations. And we also want to reach the physicians who are serving those populations. Through the campaign, we want to serve as a national credible resource and leader in HIV prevention. And all of these campaigns are important because they help create an enabling environment that supports all of our goals in providing HIV prevention, testing, and treatment programs. And it also helps us reach our stakeholders and key opinion leaders who are in charge of resources to make sure that we have the funding and the resources and the personnel, et cetera, to be able to do this important work. So as I mentioned, there are several different campaigns under the Act Against AIDS banner. Right now we have 6 active campaigns, which you see on the bottom there, and 4 in development. And we are trying to reach a variety of different audiences, the general public through general awareness campaigns, and then some of the populations most affected by HIV that you see up there on the screen. We're also trying to reach those healthcare providers. So hopefully several of you have, or many of you have seen some of these campaigns out and about. I'm going to be talking about Let's Stop HIV Together. We have our Testing Makes Us Stronger that Charles just mentioned for Black, gay, bisexual men. Our Take Charge, Take the Test for African American women. And then a few other provider campaigns, one for general healthcare providers to get them to test individuals for HIV, another for healthcare providers who serve persons living with HIV, and to get them to incorporate prevention into their practices, and then another campaign that we have for primary care providers and OBGYNs to encourage prenatal testing for HIV. Lisa mentioned that not only do we have our social marketing campaigns, but we have really key funded partnership activities. And this is the Act Against AIDS Leadership Initiative. And what we do is we fund 19 of the leading civic and social organizations in the country that reach or represent populations hardest hit by HIV, including the African American community, Hispanic Latino community, and the Black, gay, bisexual, and other men who have sex with men community. And I can't read all of those 19 logos, but just so you know, a few of those is the NAACP, the National Medical Association, the National Urban League, the National Hispanic Council on Aging, and also the Center for Black Equity and the Black Men's Exchange, just to name a few. And the idea is to work with these existing organizations who already are doing addressing many other issues, to get them to prioritize HIV and to become a conduit for which to get some of our messages from CDC through their channels. But these organizations in and of themselves have created very innovative activities to do HIV prevention, conferences, testing activities throughout the country. So I encourage you to get to know about these groups and the good work that they're doing. So I want to shift now to the Let's Stop HIV Together campaign. And when you all came in, hopefully in your conference materials, you got a card like this. If you didn't, and if you want to look in your folder, you might have one in there. You can see some of the creative on the card. And we have a few more that we could pass around in a moment. But basically, this is our new general awareness campaign that we were pleased and honored to launch this past July in conjunction with the International Conference on HIV that took place here in Washington, D.C. And the goal of this campaign is to increase HIV awareness, knowledge, and information seeking, decrease stigma associated with HIV, and increase support for people living with HIV. And this is a really significant change for us at CDC. This is our national general awareness campaign. Some of you may be aware of our previous campaign, which was called 9.5 minutes. Every 9.5 minutes, someone's newly infected with HIV. I see some heads nodding. We had to retire that campaign because A, the epidemiology has changed, but B, as we had heard and we know it's important to put a face and a voice to HIV. And this is one of the first national campaigns, the first federal campaigns from the US government that actually highlights persons living with HIV. So again, you have some of that creative in front of you, and you can see it up here on the screen. But our creative features people living with HIV alongside someone who's important in their lives. And I'm pleased to say that several folks in this room are part of the campaign. Michelle Lopez, thank you very much, is part of the campaign. I'm sorry?
Rodney.
Rodney's back there. Rodney, thank you. And I don't know if there's a few others. So what we do in the campaign is we feature the individual living with HIV alongside an ally. And that could be anyone in their life, a partner, a family member, a loved one, a coworker, a neighbor who's supporting them. And the campaign really identifies a broad range of folks who have participated in terms of age, race, ethnicity, sexual orientation, gender, occupation, and their interests. So each one of these people put out their own I am statements, and they had 3 things to say in addition to saying that they're living with HIV, saying that they're more than their HIV. So I know we're here to talk about stigma and the role of stigma, but we're really excited about how this campaign can help address stigma. And I won't spend too much time here, but the first bullet just says that the National HIV/AIDS Strategy says we should do it, and so that helps support doing this type of work. And the bottom table you see there, Dr. Rana, that might be hard for you to see, especially with the lighting in here, but this is exactly what you were referring to. There are several surveys out there that measure stigma in the United States. This is a compilation of different elements from a Kaiser Family Foundation survey and one that CDC does called Lifestyles. One had 3,000 folks and the other had 6,000 representative sample of the US population. And we were able to break it down across different racial and ethnic groups. You see there Hispanic Latinos in the first column, whites, blacks, and then overall in the last column. So just to read a couple of these, I'm just going to read the overall statements. Their overall numbers. Agreement with it's people's own fault if they get AIDS, almost 30%. Discomfort having HIV positive teacher for their children, again, almost 30%. Discomfort having food prepared by someone who's HIV positive, just about 50%, 46% there. And I think most importantly, belief, the individual's belief, and the rejection, that they would be rejected by their community if they were found out to be HIV positive. A staggering almost 30%, 28% of the respondents on these surveys said that they feel like they would be rejected from their community. And I think we've heard a lot today that that's just not acceptable. Here we are in 2012, 30 years after the epidemic began, still having this level of stigma in our community in the United States. We need to address it, each and every one of us. I won't spend too much time here. I think any study that you put out there can't substitute for what we heard today from the voices of persons living with HIV, from people like Michelle, from Rodney, from Raven, from others, to talk about their personal experiences of stigma. But we also have a body of literature that shows us scientifically that stigma is related to lower levels of HIV knowledge, less likelihood of participation in HIV prevention efforts, the adoption of preventive behaviors such as condom use, the ability to disclose to your status to others, and getting an HIV test. So stigma is truly an important issue that we need to address in our HIV prevention efforts. Often when I tell people that we're doing another national HIV awareness campaign, I hear, well, why are you doing another campaign? People know about HIV. We don't need another general awareness campaign. Well, I wanted to present with you some data on this issue as well. And this is a survey that was done this year in 2012, right before the International AIDS Conference, and it was published by the AP in several major newspapers. So each one of these pies says something different, so these pie charts. So the first one says, how worried are you about becoming infected with HIV? So that area in blue, 84% of the respondents said they're not worried. Or not worried at all, or not too worried. How much of a problem would you say HIV is compared to 20 years ago? Again in blue, less of a problem, 41%. Have you yourself ever been tested for HIV? No, 40% of the respondents. Again, this is painting a picture of complacency around HIV, lack of prioritization, and the need to make sure that everybody in the US, per the CDC guidelines and recommendations, everyone 13 to 64 years of age should be tested for HIV. There's other data out there that supports this information. The Kaiser Family Foundation does a survey that we're able to monitor trends over time. And some of the pieces from that survey that I thought would be important to share here today. Again, the share of Americans who say that they've read a lot about HIV in the past year fell from 34% in 2004 down to 13% to 2011. Again, telling us that we need to keep HIV on the radar screen of Americans and of our policymakers and the folks who control resources. The proportion of Americans naming HIV/AIDS as the most urgent health problem facing the country declined from 2/3 in 1987 to just 7% in 2011. So again, all of this really supports the need to make sure that we address this complacency and the stigma that we're seeing in the US around HIV and AIDS. So back to the campaign, I wanted to share with you some of the wonderful things I think we've been able to do since the launch of the campaign this summer. We've had an integrated marketing approach. We utilize traditional media as well as social and online media. I'm going to share that with you in just a moment here. But some of the traditional media, as you may have seen some of our ads up in transit systems here in Washington, the PATH train in New York, New Jersey, in different airports like Washington and Atlanta and a few others throughout the country, bus shelters throughout the country, again, billboards, mall kiosks, and radio and television PSAs. We're really pleased to announce in the last month we've negotiated with some of the major broadcast entities in the US, NBC, CBS, Fox. Our public service announcement will now be part of their public service announcement rotation, and all of this comes free of charge as donated space. And some of that will actually be in prime time, not just at 3 o'clock in the morning when a lot of PSAs air. So we're really excited to see, though, that we'll be putting this issue back out to America. I also want to say, and many of you in this room know, I see folks looking at their iPhones and their BlackBerries and other iPads here throughout the day. This is the first campaign where we've really been able to embrace online and social media. We've paid attention to the data. We know more people are accessing information online. We know they're accessing information on handheld devices such as smartphones or tablets, and we've really tailored our messages to reach folks there. So as you see here, we have Facebook page, Twitter account, and YouTube videos, and I'm going to share more about that in a moment. I'm going to ask Maria Alvarez, she has a card there that she's going to be passing around, maybe one on this side and one on that side. It's a little card that's coming around with our website, but also our Facebook page. I'm going to encourage you to go to our Facebook page, like us, and follow us and see what we're doing with Act Against AIDS and the Let's Stop HIV Get Together campaign. I'm really excited to say today, actually, for the first time, we're launching a new Facebook application where people can take the background of Let's Stop HIV Together, upload their picture, add their own I am statements, and then share it within their networks. So if you go and visit us on Act Against AIDS today, you'll see that we're launching that. And that's something we were able to get cleared just in time for World AIDS Day, so we're really excited about that. We have over 34,000 people following us on this on Act Against AIDS, which we're really proud of and excited about. In just over 2 months, we've been able to engage that many folks around this issue. I think most significantly for this campaign, we've really been able to utilize YouTube. Some of the creative that you see on the card that you have in your packet and that you see up on the billboards, we took as part of photo shoots, but we also did video shoots when we did the photo shoots. And people, we recorded their stories, and we put together 2 to 3 minute video vignettes. And I hope if technology doesn't fail us, I can show you one in a moment. But if not, I just want to describe that each one of these individuals is up on YouTube. We've had over 600,000 views of these digital vignettes. People want to see it. They want to be engaged in these stories. And it's funny to see, even within the vignettes that are currently available, we have a whole bunch more that are about to come online, that some of them have gone viral even within the ones that are available. And the top one is a participant named Kelly Gluckman. Her video alone has over 300,000 hits. Now, Kelly, actually, ironically enough, has also been selected by MTV to be part of a new, they're doing a show tomorrow, World AIDS Day at 7 p.m., MTV, TiVo it, or go home and watch it, or she'll be featured in that, as well as with 2 other young people talking about their struggles and living with HIV and AIDS. So we're really excited that she was selected to be part of that effort as well. So if technology doesn't fail me, I would like to play one of those video vignettes stories for you right now.
I was kind of a reckless teenager. I got into some partying and things as a teenager and became addicted to crystal meth at the age of 18. I got really sick and was rushed to the emergency room and had no idea what was going on and didn't realize at the time that I had pneumonia and Kaposi sarcoma. I only had 5 T cells, and it's a miracle that I'm even alive today. The first thing I would say to someone who just recently found out they were HIV positive is, 1, you're not alone. You're not in this community by yourself, and you don't have to die from this. I'm a huge advocate for people living out their dreams and living out what inspires them. We were all put on this planet for a purpose, and just because you've gotten an HIV diagnosis doesn't mean that your life has to end here. If you know how to protect yourself, then you're not only protecting yourself, you're protecting any future partners you might have, you're protecting your children. But most importantly, you're protecting yourself. I would encourage my brothers and sisters to stay as educated and connected as possible. Once we can come together to eradicate stigma, well, then people can walk out with their heads high and they can feel okay about themselves. Just because someone has HIV doesn't mean that they don't have the same personalities, that their feelings don't get hurt. You know, I want to let people know that it's more common than you think. It is your cousin, your neighbor, your waiter. The thing that my mom did that helped me out so much was just let me know she would never leave my side, that she would always support me. That is the most effective help that anyone can ever receive. It's just to know that you're going to be there and you're not going anywhere.
At first my heart sunk, but because of his upbeat personality, and I believe he sort of kind of became okay with it just for that split second to tell me. His delivery wasn't doom or gloom, I'm gonna die. It's, Mom, I'm going to live. Can I come and live there with you? My son has HIV, but that doesn't define who he is.
Let's stop HIV together. Get the facts, get tested, get involved.
So again, each one of those stories are equally inspiring, and I encourage you to go to our website and to listen to them and to hear them. And I actually want to just take one moment in this public forum to thank people like Jamar, who was a contestant on The Voice last year, to thank people like Michelle and like Rodney for the courage that they have to come out, to give a voice, to put a face to the disease. And as you see, all of the wonderful response we've gotten with the campaign, we really, really appreciate it. So if we can give them a round of applause. So I'm almost done here. Just to let you know that in addition to some of the paid or donated media that we receive, we also do a lot of public relations. And in the last year with the International AIDS Conference and a lot of renewed interest in the U.S. about HIV and AIDS, many of our campaign participants were interviewed and participated as spokespeople in different articles. And so we have over 60 articles on the folks who were involved in the campaign. And this is Haidia Broadbent, who is part of our campaign, is a really well-known activist as well. And so this has been an important piece to our overall strategy. Briefly, just to say, the campaign's relatively new, so we have some process evaluation to share with you. Again, over 37 participants, over 300 million media impressions, 600,000 hits on our YouTube pages, a lot of donated media space, which we're really proud of. Almost for every dollar that we put into the campaign, we see back in donated space, and over 34,000 likes on our Facebook page. As far as next steps, even though we launched in July of this year, we're really planning on taking things to the next level in the new year. We had a little bit of a hiatus during the election period. There was a lot of competition to get good rates for, as you could, what you would expect to get good advertising and media buys and that type of thing. So we'll be going back out, moving into 19 additional cities in January. A real focus on Hispanic Latino audiences. We've done some photo shoots that we in the last few months where we've had additional participants that are Hispanic Latino and Spanish speaking. So you'll be seeing more of the campaign throughout the country. And this is just a preview for you to show some of those folks who are participating in the campaign who you might not have seen yet, but will be launched in the next wave. Yes. And it's as the campaign keeps going, I keep getting folks coming up to me saying, well, I know someone, or I want to be part of it. And in fact, I think some of the people you see up here, I think Lisa maybe recommended a few folks to us last time. And if you know people who would like to be part of the campaign, or if you'd like to be part of the campaign, please come and see us.
Just to mention, the husband and wife in the corner, they were at the first Stigma conference we had, which was Reggie and Dion. Nice.
Thank you. Mm-hmm. So finally, I just want to conclude to say that we always have campaigns that we're thinking about in the future, and one that we have received funding for is a campaign for prevention for persons living with HIV. And so we've heard a lot about the continuum of care today, about the importance of linking people into care and engaging them or retaining them into care. And so we had a consultation that was done in September of this year with many external consultants who recommended that we really try to target those 49% of the people in care, out of care, excuse me, in that continuum, and make sure that we get them in care. So it's a benefit for them as an individual, for their health, but also from a prevention perspective. And so that will be one of the next campaigns that you'll see in the future. So with that, I'd like to conclude and thank you all very much for your time and your attention.